The opioid crisis. Opioids are prescription drugs used for the treatment of acute and chronic pain. However, among society, these compounds are widely feared because of their association with addiction, abuse, and adverse effects. Despite these fears, the use of these opioids continues to increase across North America. Canada and the United States of America are the two largest consumers of opioids worldwide. In the year 2016 alone, more than 46 Americans died every day from drug overdoses involving prescription opioids. This is more than 5 times the number of deaths in 1999. In Canada, 2,458 total deaths were due to opioids, making this the deadliest drug crisis in Canadian history. Here are some short answers to the key questions about the crisis. So what exactly are opioids anyway? Opioids are a class of drugs that interact with opioid receptors on nerve cells in the body and brain. They decrease feelings of pain and activate the reward areas of the brain by releasing the hormone dopamine, creating a feeling of euphoria. Oxycodone, morphine, and codeine are all examples of opioids. So what is this crisis about? In the past, opioids were only prescribed for severe acute pain, cancer patients, and the terminally ill. But in the mid-90s, new opioid painkillers like OxyContin were aggressively marketed by the pharmaceutical industry and were claimed to be less addictive. This aggressive and misleading marketing resulted in a sharp increase of the availability of pharmaceutical narcotics. Despite these claims, many people who were prescribed OxyContin moved from legitimate use to dependence and then abuse. And over the next decade, the prescription of opioid painkillers exploded. Individuals who lost access to legitimate sources turned to heroin in search of a cheaper, more accessible replacement. Data from a decade of research show that the initiation of heroin usage was 19 times higher among those who had already tried another opioid. In addition, a study from 2009 found that 86% of injected heroin users had used opioids prior to trying heroin. Injected drug use increases the chances of contracting infectious diseases. As a result, overdose deaths involving heroin tripled between 2010 and 2015. Then, in 2014, potent synthetic opioids like fentanyl began entering the drug market in large amounts. British Columbia, Ontario, and Alberta have been hit the hardest by this crisis. In 2016, 931 British Columbians died from opioid drug overdoses, with fentanyl being detected in 60% of those deaths. That's 3 times the number that died from motor vehicle accidents in the same province. Odorless, tasteless, and undetectable. The biggest issue is that illicit drugs, especially heroin, are being cut with fentanyl. Fentanyl is a prescribed opioid that is 50 times stronger than heroin and 100 times stronger than morphine. Fentanyl is easily produced and is relatively cheap. Most production occurs in China and is distributed through the dark web and Mexican drug trafficking organizations. Shouldn't we just stop prescribing opioids? Well, not necessarily. Opioids improve the quality of life for millions of people. Suddenly removing access to opioids from those who are dependent on them could easily push people to more dangerous alternatives. Then how can we prevent this? Healthcare providers should be well aware of the long-term effectiveness of opioids and the associated risks, including addiction. If patients are showing symptoms of addiction, medical professionals should help them access resources such as therapeutic and rehabilitative assistance. So what can be done? There are many variables, but any solution would require controlling the distribution of prescription opioids and expanding access to medication-assisted treatment. In Toronto, police started carrying naloxone, a life-saving drug that can reverse the effects of a fentanyl overdose. In addition, drug testing services or supervised drug injection sites may be necessary to slow the rise in overdose deaths. If you or someone you know regularly uses recreational drugs, you should be aware of signs of an overdose. These include sleepiness, slow heartbeat, trouble breathing, and cold, clammy skin. In all cases of a suspected drug overdose, you should call 911 immediately. Finally, if you choose to use, be smart. Always start with a small amount and never use alone. A message from the Biology and Pharmacology program.